afternoon, everyone. This is Marie with Your New School. If I can please have you type in your full name and school name into the chat box for attendance. Please make sure that it is your full name and full school name. Please do not abbreviate your school name. There's so many schools that have almost the same, if not identical, abbreviations. So I want to make sure that I'm sending your name to the correct location for attendance. So again, full name, full school name, and your school location into the chat box, especially if you are from a campus that has multiple locations. Hi, Emily, I just made you co-host. I don't know if that showed up on your end.
Yeah, I got a little notification.
Beautiful.
Did we record Nancy's webinar?
Yes, I just sent the recording over to Teresa. Hopefully she can get that onto YouTube at some point today, or if not tomorrow.
Okay, awesome.
Excuse me. All right, so we're going to start in just a couple of minutes. This is Marie with Your New School. If you have not done so already, please make sure that you have typed in your full name, full school name, and your school location into the chat box so that we are sending the attendance to the correct schools. And then I'm gonna hopefully try to get this webinar done in an hour. It might be closer, it might be over an hour, I'm not gonna lie. So hopefully though, I can get through it. We won't have any internet issues, but I can't promise you anything these days. And let me know if my PowerPoint's popping up.
Yeah, we can see it.
Beautiful. So we are going to get started. Good afternoon, everyone. My name is Marie Strauch. I am the educator with Your New School. Today's webinar is going to be going over the Only Yours Dermaprint. This webinar is typically divided into two categories, Dermaprint 1 and Dermaprint 2, which kind of breaks down the Dermaprint form into two separate webinars, but I am going to do both of them today because I wanted to squeeze both in this week. So, before I begin, please make sure that you have typed in your full name, full school name, and your school's location into the chat box so that we can track attendance. Also, please be mindful of your microphones and keep them muted. With the large number of participants, it creates a lot of feedback. If you have questions, please utilize the chat box. I'm going to do my best to get Dermaprint 1 and 2 done within the hour. It most likely will go just over the hour, but I'm hoping not too much over. Emily is also with Your New School, so she's going to help me man the chat box. I'm going to minimize a bunch of screens on my side so that we can focus. So welcome, everyone, to Dermaprint. So Dermaprint, if my slides will advance, is our exclusive Dermaprint skin analysis is the most scientific, effective skin analysis system in the professional skincare industry. It is the only proactive and corrective system that addresses multiple complex combinations of skin conditions, then guides you to the right in-salon treatment or treatment series and custom blend home care products to correct the skin's conditions. So things that you are going to need for your consultation is your client history folder. The client history folder is your main source of information while treating your client's skin. It's going to enable you to gather valuable information including lifestyle, genetic and environmental factors, medical history, medications taken, sensitivities, allergies, their current skincare regimen, all the important factors that could affect the skin. Then you're going to need your actual Dermaprint form. And this is the key to recommending the appropriate skincare products and in-salon treatments, all geared to your client's specific needs. You're also going to want your treatment series brochures. This is going to explain the treatment benefits and the treatment procedures for each of the 5 treatment series programs. And then you'll have your client home care card. These are just easy to follow and understand. These brochures are going to explain how to use the home care products and in what order. And then you're going to need a highlighting pen or a highlighter pen or just something to write with. If you don't have a highlighter, you can always just circle as opposed to highlighting on your Dermaprint form. So the first step is to determine your client's skin type. So you want to first do your visual analysis. You want to determine your follicle size. You're then going to try to figure out the oil zones, when the oil zone surfaces, and then you're going to figure out your oil zone. So there's basic questions that you're going to ask to answer these 3 questions, and once you have these 3 questions answered, you're ready to move on to the next step. Also, you want to make sure that you're scheduling first-time clients in the afternoon, just so that you can get a better and more accurate read on their oil zone. So your first visual analysis for your follicle size. So here we can see a range of follicle sizes. Generally, the pore size varies on different areas of the face, generally being larger in the nose area and then becoming smaller towards the outer face. Once an individual begins puberty, oil production begins. And at this time, the follicle enlarges to reflect the size of the sebaceous glands that they serve. So the larger the gland, the more oil it will produce. It's during these years that the follicle size is fairly accurate in skin typing tool. The follicles remain the same size for the rest of the individual's life. So to do your visual analysis, you want to turn the head to look perpendicular at the face and then gently spread the skin to help see the range of your follicle size. If needed, you could use a mag lamp as well to help determine your follicle size. And then once we determine our range for your follicle size, you're going to highlight the largest follicle size that you see. So for our example, our model is medium. So your choices to choose from are very large, which the appearance of that would be looking like an orange peel. You can actually see these pores, they're clear from a distance. Then we have large, medium, small, and very small. And very small would be something that we would describe as porcelain-like skin. So again, for our example, we're going to say that our client's largest follicle size is medium. So next you need to highlight the 2 sizes to the left or the next 2 sizes smaller. This is going to give you your follicle size range. So for our example, since we know that her largest follicle size is medium, we're going to highlight small and very small as well. Now we need to determine the time of when oil surfaces. So this is when you're going to ask your client, at what time do you cleanse your skin in the morning? So we're going to say they said 6 a.m. And then at what time of the day do you see or feel oil on your face? And we're going to say our client said 5 p.m. So you're going to figure the number of hours from the time they cleanse to the time oil surfaces. So again, our example from 6 a.m. to 5 p.m., their oil is surfacing 11 hours. So we're going to highlight 10 to 11 hours on our Dermaprint form. And then we always mark 2 boxes that best describe the client. So we're going to highlight the 10 to 11 and then 12 to 14, and this is going to be our range. So physical analysis of the width of your oil zone. So this is where, so your physical analysis means, you know, where we see the sheen and we feel the skin to determine the width of the oil zone. Also, we need to determine if it's really sebum, perspiration, or moisturizer on their skin. So you're going to take your client's chin and slowly move the client's head side to side, allowing at least 3 seconds between transitions. You want to tilt the client's head back slightly so that you can see light reflecting off of the skin. Signs of an active oil gland include a shiny appearance, visible oil on the skin surface, and open and closed comedones. So again, you're just going to slightly turn, and you want to wait 3 seconds between transitions. So questions that you want to ask the client: did you apply moisturizer today? And if so, around what time? What kind of moisturizer are you using? Is it light, medium, or heavy in consistency? So when you're doing your feel, moisturizer is going to feel slippery, whereas oil is going to have more of a greasy, waxy, or sticky feel to it. So the physical inspection of the skin, you're going to place your index fingers up on each side of the outer face at the ear area, and then you're slowly, with light pressure on the skin surface, you're going to slide your fingers towards the nose, feeling for the outer edge of the oil production zone. And you'll place your index fingers up on the sides of the outer face and the ear area, and slowly, with light pressure on the skin, slide your fingers towards the nose, feeling the outer edge of your oil zone. And then you're going to mark the box that best describes your client. So our model, we're going to say that the oil zone extends to the inside edge of the eye. And then your choices are the nasal area, inside edge of the eye, inside edge of the iris, outside edge of the eye, or the entire face. Now, once you've gone through each section and you've answered all 3 questions, you're going to find the skin type with all 3 factors highlighted. If after your analysis you find that there is not a column with all 3 highlighted, then you would choose the most telling factor, which is the oil zone. But for our model, we do have all 3 highlighted, and our client's skin type is skin type 2, dry. So now your skin type analysis is complete. So now if you're only going to be retailing the clinical care products and not doing custom blending, you're now ready to recommend your home care regimen for your client. I'm going to mute somebody's microphone. Give me 1 second. So now let's learn how to recommend and sell your home care regimen for each of your skin types. Slide is frozen. There we go. So for our skincare, when you're selling the Only Yours products, we have, it's called 6 for 5. We have a complete set of 6 products for each of the 5 skin types. These products will adjust the skin into its optimum balance. So keep this in mind. So our clinical products were specifically formulated to meet the needs of each specific skin type. The clinical skincare products are the core of the Only Yours system and provide a complete selection of products in both retail and professional size. Our products contain the highest concentration of active ingredients from plant extracts, natural minerals, vitamins, and proteins that were specifically chosen to deliver superior results. So the clinical care products are the core of our system. They provide a complete selection of products, again, retail, professional, and travel. And we also have starter kits for all 5 skin types. They're designed to protect, repair, and renew. And again, they're going to deliver maximum results. So in our clinical skin solution, we have a 3-step home care regimen for your clients to follow. So they have a morning and an evening regimen. Both of the regimens have 3 steps: cleanse, tone, and moisturize. So in the morning, their cleansing step is actually just applying a mask, leaving the mask on for 10 to 15 minutes, and then use a scrub to remove the mask. There's no need for cleansing because they should have done this the night before. Then they'll tone, which is going to help balance and repair the skin, and then they'll moisturize, and the moisturizing step consists of a gel hydrator, their moisturizer, and a sunscreen. In the evening, their evening regimen, again, cleanse, tone, and moisturize. They're going to cleanse with their cleanser to remove their makeup and any daily debris. Use their toner, which is going to balance and repair the skin, and then apply their moisturizers, and their moisturizing step is a gel hydrator and a moisturizer. There's no need for sunscreen in their evening regimen. So, why do we mask and scrub in the morning? This is called proactive cleaning. So the mask is going to be applied to totally cover the skin and prevent any exchange between the skin and the environment. This forms an application that creates a suffocation of the tissue and induces a physiological process for the rapid elimination of waste products. Once the mask is applied, the skin sends nerve endings conveying a signal to the brain that there is something suffocating the skin. The ingredients of the mask, no matter how sedative the action, are perceived as foreign substance to the tissue. Because of this perceived threat, the brain triggers the body's immune system to begin an attempt to neutralize the reaction taking place on the surface of the skin. And then excessive blood serum is directed into those areas. This serum contains tremendous amounts of fluid or lymph with white blood cells, particularly lymphocytes. These sensitive lymphocytes cross through the capillary wall and begin through a chemical process to accumulate excess moisture within the tissue. At the same time, the excess amount of blood stimulates the eccrine gland, and production or excretion of its waste product is activated. And then the scrub is applied in a gentle circular motion to remove the mask. This will not only remove the mask, but it's also going to remove impurities, dead skin cells, leaving the skin fresh, clear, and smooth. So the morning cleansing kickstarts the self-cleansing mechanism, lymph and blood circulation, which is going to help maintain healthy, functioning skin, leaving the skin clear, smooth, hydrated, and radiant. So to recap, when we apply the mask, nerve endings convey signals to the brain that there's a foreign material on it. The brain triggers the immune system. Excess blood serum is directed into those areas. Lymphocytes cross through the capillaries, accumulate excess moisture. This hydrates the skin. And then at the same time, excess blood stimulates the eccrine gland, which is 99% water. Fluid puts pressure on these follicles, helps to purge the impurities and impaction. And then the scrub is used to remove the mask along with the impurities and dead skin cells. Now, if you have a client with sensitive skin, inflamed acne, rosacea, or other types of sensitivities, you can direct them how often they should do a proactive cleansing. So they don't have to do this every day. If their skin is really sensitive, they might want to do a kickstart like twice a week. It just really depends on the client. So the skin's moisture system. So the epidermis holds large amounts of water. The germinativum layer holds about 80%, corneum layer about 10%. Water is held in space between these cells. The skin's capacity to retain water decreases with age, making it more vulnerable to dehydration, wrinkles, and sensitivities. Cells held together and surrounded by lipids called cellular cement. This plays a crucial role in skin's water retention ability by acting as a barrier to trap water and prevent water loss. Gel and cream moisture systems mimic and restore the skin to a healthy balance. So the skin's moisture system contains oil that hold water between the cells, needing the skin to stay soft, flexible, and firm. The gel hydrator, which is in our kits, the skincare kits, contains a humectant. This acts as the moisture magnet, and it pulls water between the cells, directly increasing the stratum corneum's moisture content. The moisturizer and then the sunscreen, that's going to lock in the moisture, aids the lipid barrier protection, and protects the skin from the environment. Now, if your client does not want to use both the moisturizer and the sunscreen over their gel hydrator, then we recommend that they use the sunscreen for daily protection and then just use the moisturizing cream at night to nourish and balance the skin. Because you always want to protect your skin from damaging UV rays. So we always tell them, if you're going to opt out of the moisturizer and go straight for your sunscreen. And all of our sunscreens are moisturizing sunscreens, so they are a moisturizer with SPF in addition to your moisturizers. Now, your home care card. So the home care cards is an effective tool that explains how to use all of the home care products from both day and nighttime routines. Clients are more apt to purchase products when they're given specific instructions on how to use them at home. So this is what your card is going to do for your clients. On the outside, it's going to list the characteristics of your skin type. So we have a home care card for every skin type. So for this example, which is our client we said was dry, the outside is going to give them all the characteristics of dry skin, such as the oil zone and the follicle size. It's going to tell them the common problems, such as recessive blackheads and dehydration. It's also going to give them the goals within the treatment. So it's going to tell them that their treatment is going to normalize the moisture level, dissolve those blackheads, combat surface dehydration. The inside of your trifold card is going to give them their home care regimen. It's going to explain what's in their kit, their mask, their scrub. It's going to explain the proactive cleansing system. It's going to tell them how to use each of these products, and it's going to be numbered in order. So it's going to tell them how to cleanse, tone, hydrate, and lock in moisture. It's going to give each of the products names and descriptions. It's also going to give you your suggested custom blending possibilities with your home care product. And then on the back side, or the additional panel, is going to give you other products such as our eye care products. It's going to give you company information, other products that are available for that skin type, and there's also going to be a blank area where you can put your salon information on there. So if you have stickers or labels that have your salon's name, address, phone number, or for students, you can create your own labels that show, the days that you're available on the clinic, all that good stuff. There's an option or a space for that as well on your home care card. So Dermaprint 1, skin analysis, we've determined our skin type. So we know that our model has dry skin, skin type 2. We talked about that we have our 6 products for all of our 5 skincare types. So again, every skincare type has their own products, and then why we should be using these products, and then using them in your clinicals, treatments, as well as home care. So the next thing is to move on to Dermaprint number 2, which is going to talk about the second half of our Dermaprint form. So I'm going to flip PowerPoints really quick. Let me know when it pops up on your screen. Come on. Emily, is it on the screen? Does it say Dermaprint 2?
It is.
Thank you. All right, So before we get started on Dermaprint 2, for those of you who are just jumping on, if you have not done so already, please make sure that you've typed in your full name, full school name, and school location into the chat box for attendance. So moving on to Dermaprint 2. So Dermaprint 2, again, my screen is frozen. Sorry about that. We've already talked about all the things you need to perform your Dermaprint. So Dermaprint 2, the second half is to identify your skin conditions. So here we need to determine the appropriate custom blend home care and salon treatment for our clients. There are 12 categories of correctable skin conditions that we have to go through. They're listed in order of treatment priority. Sensitized skin would have the highest priority. So you need, when you're doing your analysis on your client, you have to go through each and every one of these. And to help us do that, we've divided the face into 7 zones. And then by identifying the skin condition in those zones, we'll determine our cause of action of what we're going to do. So we're going to begin with the first skin condition, work your way down, marking each condition and location appropriately. Mark whether the skin condition is mild, moderate, or severe. So for each skin condition, so we're just going to go through the first one, for example. Sensitized skin, which could be burns, sun, which is either sun, chemical, or wind, or heat. So you'll circle which one it is, and whether it's mild, moderate, or severe, temporary, or chronic, and then based on where you're finding these sensitivities is what number you would highlight in corresponding with the face. But if it's all over their entire face, let's just say it's sunburn and it's their whole face, you would circle all, because it's all over their face. So again, we have the facial zones report, and we have them 1 through 7. You're going to mark which number corresponds to where you see that skin condition on your client. And this is also a great way for tracking for future appointments, because let's say they did come in with sunburn, and let's say it was just on their cheeks and their nose, so you highlighted 2, 5, and 7, but now they come in for their next service and that's gone. It's cleared up, it's healed. So that's why we want to make sure that we're checking those areas as well, just to make sure that they don't have excessive sensitivities there in their next appointment. So we're going to go through each of the skin conditions. We're going to talk about each of them. So again, first one, sensitized, burn, whether it's sun, thermal, chemical, or wind. Appearance of sensitized skin could be redness, flaking, warm to the touch, and pain, especially if it is sun exposure. So sunburn, overexposure to the sun, damaging rays, or tanning beds even. In addition to sunburns, these damaging sun rays have a cumulative effect and can result in a variety of skin eruptions, irregular pigmentation, premature aging, and possibly skin cancer. Increased burning might have been caused by antibiotics. So if they are on antibiotics, that could have been a reason why they burned so quickly. Diuretics could also cause sensitivities to the sun, and oral antidiuretics, medications, many products that have skin sensitivity to the sun are perfumes, retinoids, alpha hydroxy acids, beta hydroxy acids, benzoyl peroxide, and again, medication. Heat, this is damage to skin tissue due to excessive temperatures such as waxing, curling irons, flat irons. Chemicals, this is an overexposure, or chemical sensitivities, is an overexposure to chemicals such as alpha hydroxy acids or chemical peels. And then wind is overexposure to the wind. So here's some examples of sensitized skin. We've got mild sunburn, chemical burn, and severe chemical burn. Temporary sensitized skin. So temporary sensitized skin appears as red patches, inflammation, edema, or warm to the touch, possible dehydration and flaking, and then there's temporary stinging or itching. Factors that can cause the skin to be sensitized temporarily is like Accutane, antibiotics, diuretics, hormonal changes. So again, that's temporary because your hormones change. So pregnancy, menopause, those can change the sensitivities of your skin. Sometimes 7 to 10 days prior to a menstrual cycle, your skin can be a little more sensitive. You may have had an aggressive treatment, such as a chemical peel, microdermabrasion, laser, or types of surgeries could have caused this temporary sensitivities to your skin. So here is a temporary sensitized skin, so like an allergic reaction. Chronic sensitivity. Again, red patches, inflammation, edema, warm to the touch, burning, itching, stinging, and stinging sensations. Factors that put the skin in a highly sensitized state for chronic could be an allergic reaction, allergies, severe dehydration, skin diseases such as eczema, psoriasis, or seborrhea. So here's an example of a chronic sensitivity. Our second skin condition, compromised barrier. So this could be scrapes, cuts, abrasions, lacerations, fissures, punctures, wounds, etc. Typically, it's caused by an injury or surgery. And this would be an example of a compromised barrier. Another compromised barrier could also be men. If a man is coming in for a facial and they have just shaven their skin, there could be a compromised barrier state. So you definitely want to be careful if they've just freshly shaven. Even though they're not seen, you don't see any cuts and scrapes, but there is just microscopic little cuts and scrapes from their razor. The accelerators or some of your products could cause a little stinging. So just let them know that that's probably normal if they've just shaven. Dehydration. So dehydration appears dry, scaly, sometimes flaky. It feels tight and it will crinkle when gently squeezed. The skin has a tissue paper appearance. The skin may be shiny, taut, and irritated. Severe dehydration will lead to cracking, itching, and burning. Primary causes is lack of epidermal lipids to hold moisture in the skin. So contributing factors for dehydration: not drinking enough water or drinking too many diuretics such as tea, coffee, and sodas, caffeine. Too much sun or wind, or living or visiting an area with extreme climates, deserts, mountains, etc. Not using moisturizer or not using the correct moisturizer for their skin type, and using harsh skincare products such as soaps or astringents that will strip the skin's moisture barrier. So here's some examples of dehydrated skin. Now, dehydrated skin, you must correct dehydration to prevent creating other skin conditions. So dehydration can create or worsen other skin conditions, skin sensitivities, burning, itching, flaking, redness, open and closed comedones, acne, milia, capillary distension, fine lines, and rosacea. Skin is very receptive to extraction and penetration of treatment products, so you must correct the skin condition to prevent creating other conditions. So keep that in mind when treating dehydration, or if you're looking at other issues on the skin, you always want to treat the dehydration first. It takes priority. Excessive dryness. The appearance is dry, rough, scaly stratum corneum. It feels tight and may appear irritated. Severe dryness will lead to cracking, itching, and burning. Primary cause: mature and environmentally aged skin. Basal skin cells, as they move to the surface of the epidermis, produce two different substances, keratin and lipid. It is these lipids that combined to form intercellular moisture. As we age, we produce less of these cells and their accompanying lipids that are being produced. So maturing skin also has an increased cause of thinning of the skin. Living in an area with extreme climates, too much wind, If you are somebody who's always in air conditioning or central heat and that you rarely have exposure to natural air, can cause excessive dryness because there's no moisture in the air if you're in air conditioning and central heat all the time. Also, if you're using products that have a high content of alcohol in them, or you're not using the correct cleansers and moisturizers on the skin and you're using harsh soaps instead. If you're using too much of a chemical exfoliation or alpha hydroxy acids. And then also medication can cause excessive dryness as well. So these are things that we want to make sure that we are tracking on our client folder. Number 5 is acne lesion. So the first one we're going to talk about are cysts. This lesion is as big or bigger than the end of your little finger, and it's filled with pus and looks like a boil. Primary cause, it's a break in the follicular lining, overreaction on the part of the immune system. So inflammatory response includes itching, swelling, and tenderness. Our goal is to get the inflammation down as quickly as possible and to prevent scarring. Clients with cystic acne need to be referred to a dermatologist. And here's an example of cysts. Nodules, they appear as inflamed bumps larger than the end of your finger. Like a papule, a nodule is a solid dome shape, irregularly shaped lesion. It's characterized by inflammation, extends into deeper layers of the skin, and can cause tissue destruction that results in scarring. A nodule may be very painful. The cause, again, is a break in the lining deep in the follicle. And then to help with the inflammation and to accelerate healing, it's best to ice to help reduce that inflammation. So your inflammation may last for several days or even weeks. The longer the inflammation lasts, the greater the loss of tissue and more chances of scarring. A pustule is a papule with pus. White blood cells clump together. So within the first 72 hours of a follicular break, the white blood cells may clump together, forming pus, which will migrate to the surface, bringing the impaction material with it. Once the impaction and the resulting inflammation is swathed off or is extracted, the matter is ended. Some damage may have occurred to the surrounding tissue, but not much. If it all happens fairly quickly, and there may be no scarring at all. And these are pustules. Papules are small elevated skin lesions less than 0.5 centimeters in diameter. It is prolonged follicular congestion, and the breaking down of the follicular wall is what causes them. And again, icing will help to reduce inflammation on a papule as well, and it also increases healing. So here's an example. Next skin condition, number 6, follicular congestion. This would be closed comedone or whiteheads, skin-colored or cream-colored bumps ranging in the size from the size of a pinhead to as large as the tip of your finger. It is a buildup of solidified sebum, corneocytes, and bacteria not being excavated by the follicle. So comedone is the medical term for an acne impaction. Here is an example. And next is follicular congestion, open comedone, which are blackheads. The surface of the impaction oxidizes and turns a brownish black, hence the name blackhead. It's a buildup of the solidified sebum, corneocytes, and bacteria not being excavated by the follicle, retention, keratinocyte dehydration. here are some examples of blackheads. And milia. So milia is formed by the encasement of sebum in the protein appearing as white hardened nodule just under the surface of the skin. Milia is differentiated from a whitehead or a closed comedone by its hardness. It feels like a grain of sand under the skin surface, but can be softer if it surfaces early. There's really no known cause for milia. One theory is that it's bacteria in the follicle that hasn't been released. With milia, they're usually common around the eye, on the forehead. So here are some examples, and they don't extract very easily. To extract them, you would need to use a needle or get it lanced to be able to extract them. Don't do this to yourself. Number 7, tissue congestion. This is excessive internal buildup of cellular waste material that can be felt as bumps beneath the surface of the skin, and it may be visible. The cause, congestion, prevents the skin from functioning adequately and tends to become worse if left untreated. It's usually triggered by dehydration, leading to recessive stratum corneum. Other contributing factors could be medication, improper diet, illness, and a sedentary lifestyle. And here's some examples of tissue congestion. So the difference in appearance between tissue congestion versus follicular congestion. The main thing with tissue congestion is you will see or feel small bumps on the skin, but there's nothing to extract. As with an open or closed comedone, you have something to extract. So that's pretty much the difference between the two. Uneven textured or rough textured skin. This is coarse textured, not refined and smooth. Some causes is photo and environmental damage or aging skin. So to experience what roughness feels like, you want to stroke the area of the skin that has been photo protected, and then stroke the area of the skin that has photo exposed, and you'll feel the difference. So you'll feel the difference between the skin. So when you're young, it takes about 14 days for the basal cell to reach the corneum layer, and another 14 days to travel to the top of the stratum corneum to be exfoliated. So as we age, this process slows down, and the cellular turnover rate goes from approximately 28 days to 42 to 50 days. So cellular proliferation slows down, and the buildup of the corneum layer, and this layer thickens excessively. So here's an example of rough textured skin. Uneven textured or flaky skin. These are lighter than the skin color patches, or they kind of looks like peeling skin. Primary cause is dehydration, deep damage to the epidermal tissue from either a burn or harsh products, so sunburn, windburn, heat burn, or also glycolic acid, benzoyl peroxide, or abrasion. So here's examples of flaky or uneven textured skin. Maturing skin, number 9. Loss of elasticity, fine lines and wrinkles. So loss of elasticity. This is loose hanging skin that's kind of lost its spring. It could be photo age or environmental aging. Severe loss of elasticity. As the skin ages, the fibers which give the skin its elasticity, they lose their firmness and support, which causes the skin to sag. So here we have examples of mild and severe loss of elasticity. also under aging skin or maturing skin is fine lines and wrinkles. This would be an example of crow's feet, lip lines, smile lines, worry lines. Wrinkles are caused by several factors. Intrinsic aging, which are sleep lines, gravity, expression lines, and UV radiation. Smoking and ongoing sun exposure, as well as can accelerate the aging process, which includes your deep wrinkles as well. And then as we age, we lose our elasticity. And here's an example of fine lines. Number 10, irregular pigmentation. So appearance. Hypopigmentation is a lack of pigment or melanin in localized areas. Hyperpigmentation is excessive pigment in localized areas. Hypopigmentation is a genetic disease with no known cause. Hyperpigmentation is a hormonal imbalance, so such as pregnancy, birth control pills, or tissue damage, whether it's photo or environmental aging, can cause your hyperpigmentation. So here are just some examples. Capillary distension. So these are small, dilated, winding, bright red or blue blood vessels that are visible on the skin surface, commonly seen in the nose and cheek areas of middle-aged and elderly individuals. And unfortunately, women are more likely to have them in these areas, and they often have more of a reddish color. I'm going to mute somebody's microphone really quick. Give me a moment. Oh, thank you, Emily. So here's some examples of distended capillaries. So some causes is also increased pressure on the capillary walls due to dehydration, congestion, inflammation, or increased blood pressure can also cause that. And last one is asphyxiated skin. So this is dull, lifeless complexion. The skin often appears to look shallow and gray. Some causes, the cells are not receiving proper oxygen or nutrition, and waste materials are not carried away from the cell efficiently. The result is a sluggish cellular metabolism or reproduction, hence slower and imperfect cell division. So the cells are being reproduced and are not as healthy, and wound repair becomes more poor and prolonged. So this contributing factors could be illness, smoking, mature skin, and environmentally aging skin. So here's an example of asphyxiated skin. So once you've gone through all of your skin conditions, you're going to highlight them on your Dermaprint form. So again, we go through each and every single one. We're just going to go all the way down. So our model, we're going to say, has some dehydration. It's moderate. It's all over her face. She's got some follicular congestion, and it is open comedones. It's recessive, and it's just in her nose. She's got mild tissue congestion on her cheeks, so we're going to highlight 5 and 7. She's got some fine lines and wrinkles. It's mild, and again, we're going to say that those are around her eyes, so we're going to highlight 4 and 6. And she's got some elasticity loss. It's mild on her cheeks, so we're going to highlight 5 and 7. And again, if you don't have a highlighter, you just use a pen and you circle all that correspond. And then some irregular pigmentation, we're going to say it's hyperpigmentation, mild, and just on the one cheek, so we're going to highlight number 5. We'll say she also has capillary distension, mild, and we see it on the nose, and again, just on that one side of her cheek, so we're going to highlight number 5. So now we've completed our skin analysis. So we've determined that our client has dry skin from Dermaprint 1. We've now gone through and highlighted all of our skin conditions and where they're located on her skin. So now we're done analyzing the skin. Now it's time To use this information to provide a solution for your client's specific skincare needs. You now have your Derma Solution. The Derma Solution will consist of in-salon treatments and home care products. This is where you're going to explain your findings to your client. So why custom blend your home care? So let's talk a little bit about custom blending. So it's unique. So what does that stand for? The U is, it's a unique product. They're not going to be able to find this anywhere else because you custom blended that product specifically for their skin's condition that we just analyzed. And it's no problem. It takes just a few minutes for much more profit. It's going eyes for increased client retention. They're going to keep coming back to you for your products and for your service. Q is the quickest possible results. Because you customized and custom blended that home care, they're going to get results that much quicker than if they just use the product as it is. Even though the product as is amazing, but by custom blending it and boosting those actives up to 50% is just going to increase those results. You are in control of your client's progress. And E, each client's special needs are addressed. And that's why we custom blend our products. So how do you custom blend? On the back of your Dermaprint form is going to give you a chart on how to custom blend. So on the left-hand side, this is your progress report. So you've completed your Dermaprint. You're going to do this at every visit to allow you to measure the client's progress as you treat them. This could change from visit to visit, so it's especially true that the client is showing results. On the right-hand side and the top lists the products needed at that visit. So depending on, like if you're doing your home care or selling them a home care regimen, you're going to mark down the products that you used or that are in their kit. And then on the right-hand side, on the bottom of the chart, this is going to tell you how to custom blend. So, for example, we identified that our client had the following conditions: mild dehydration, mild open comedones, mild tissue congestion, mild fine lines and wrinkles, mild loss of elasticity, mild irregular pigmentation, and mild capillary distension. So we know that that's everything that our client had on our Dermaprint form. So we're going to highlight those. And then next to it, it's going to tell you exactly what products can be custom blended and with what. So we have accelerators. Our accelerators are designed for custom blending home care treatments. We use them within our treatments. We use them to make serums. They are pure concentrated laboratory strength accelerators. And depending on your client's condition, whether it's mild, moderate, or severe, if it's mild, it will tell you that you can only add 0.5 milliliters of your accelerator. If it's a moderate skin condition, then you're going to add 1 millimeter of product or accelerator. And if they have a severe condition, then you're going to add 1.5 milliliters of whatever accelerator is needed to control the skin condition. So for example, we're going to go with the first column, gel hydrator. So each of our products, so your client's going to have a gel hydrator. In that gel hydrator, you can add the number 3 instant moisture infusion. You can add the deep pore refiner, decongestion tissue activator, anti-wrinkle activator, pigment fading activator, and capillary, crucial capillary support activator. You can put all of these activators inside that gel hydrator, and you can put 0.5 milliliters of each of those to custom blend that gel hydrator or that mask or their cream moisturizer or cleanser or toner, whatever product that you're custom blending, or you can custom blend all of them to give your client the maximum results with your product. So for custom blending, it's not something that you have to think about. We've done all the work for you. We just tell you exactly what products can be custom blended and what you can put in them based on your findings for your client. It is truly that simple. Now we need to determine the in-salon treatment. So we already know how to custom blend. We know what we're going to put in their home care products when we send them home. Now, how do we determine what service to perform? So for each of the skin condition, there's an appropriate salon treatment to the right of your skin condition. So let's just say you want to start with dehydration and we want to first treat the dehydration. You would perform a moisture boost treatment. So we've already told you what protocol that you're going to pull. And all of our products have in-salon treatment protocols to correct these skin conditions. So for dehydration, you will follow the facial protocol called Moisture Boost. Now, the conditions are listed in order of treatment priority. Therefore, you're going to choose the first condition and work your way through each of those conditions. You don't want to treat fine line and wrinkles first because dehydration has priority over that, or tissue congestion has priority. Chances are, if you're treating dehydration, you're going to treat and correct fine lines and wrinkles. You may help with the open and closed comedone. So it all depends on your client's skin conditions. So always start with the one that is listed in priority. So you're going to first treat dehydration. Now, when several conditions coexist, these must be treated differently than if each condition exists by itself. The derma solution allows you to easily determine if your client's skin conditions create a complex condition or if their skin conditions should just be treated individually. So if they're treated individually, you just follow the protocol to the right of the skin condition. But if you are going to be treating a condition group, now how do you determine that? So determine that on the third section of your Dermaprint form, which is towards the bottom. It has all of your skin conditions listed. You have to go through them, find them, and highlight them. So for our example, we know that our client had dehydration. That falls under unbalanced and cellular aging. We know that our client had comedones. They were open and recessive, and they also had tissue congestion. They had fine lines and wrinkles, loss of elasticity, irregular pigmentation, and they also had capillary distention, which also falls under unbalanced and cellular aging. Once you've highlighted all of these, and so again, for our model, we've gone through and highlighted all of our skin conditions. You're now going to determine what your skin condition group is. So again, these are also listed in order of priority. Sensitized skin, follicular congestion inflamed, unbalanced, follicular congestion non-inflamed, and cellular aging. Again, these are listed in order of priority. So from here, you're going to choose the appropriate treatment program. Our client, their skin condition group is unbalanced. Directly below unbalanced is going to be a list of 5 treatment series. And within these, there are 6 treatments for each of these. So we have our tissue desensitizing treatment series. We have a treatment series called Problem Skin Healing. We have a series called Tissue Rebalancing, Problem Skin Clearing, and Cellular Aging. So all 5 treatment series contain their 6 treatments. The number after each of these treatments represents the ideal number of days between each treatment, and this is for rapid maximum results. So for our example, since we know that our client is unbalanced skin condition group, directly below that, we are going to recommend that they receive a series of treatments, and the series of treatments is called the tissue rebalancing. And then don't forget, we have a brochure that explains each of these treatments for your client. Now, if your client cannot come in within the days recommended, that's okay. These are just suggested days to give your client the maximum results. So for the tissue remodeling, so if your client says, yes, I want to schedule my series of 6. So the first one you're going to do is the moisture boost. You're going to tell your client, okay, in 3 days, you need to come back to receive your next treatment. The next treatment is going to be the cellular sweep. 3 days after that, they're going to come back in for the deep pore cleanse. 7 days after that, they're going to come back in to receive a deep tissue cleansing. 7 days after that, they'll come back for a deep tissue cleansing again. And then 7 days after that, they'll come back for their capillary calm. And now they can come back once a month for maintenance because they've completed their series of 6. Now, if they cannot do those days, you will spread them out based on what they can do or what they can afford as well. So here's a completed Dermaprint form. So this is what it should look like when you are completely done. You've highlighted and determined your skin type. You've highlighted and determined all of your skin conditions. You've decided whether or not you're just going to treat each condition on its own, which would be your services to the right next to the face, or you're going to highlight all of those conditions in section 3 to determine your skin condition group, and then see if your client wants to do a series of treatments to get maximum results to repair their skin and rebalance it. So you've got 2 routes that you can go with your Dermaprint. You can just pick a treatment for that day, or you can offer them a series to really get maximum results. And then if you are going to be doing a series, then you're going to be using your treatment series brochure. So here on your brochure, you're going to record your appointment dates and times and the total price so that they are well aware of what this is going to cost them. You don't want to blindside them at all. You want them to know all the information up front. Then it's also going to tell them the reason for this series. So it's going to explain all of your findings and why they should be receiving this. On the inside of the brochure, it's going to list all 6 of those treatments, and it's going to explain to them exactly what's happening during those treatments and what to expect. It's also going to tell them how long it should take. So each treatment is about an hour in length. So now we've learned how to determine the skin type. We've identified our skin conditions. We use this information to recommend custom blend solutions. So if you are going to be custom blending, again, that's already done for you. There's no thinking, you just follow the chart. You're going to use the selection and select the appropriate salon treatment, or if you determine the state of the skin condition, you're then going to choose the appropriate salon treatment program or series of programs. So again, here is a full Dermaprint form complete. The back side shows all the products that you're going to be using and what to custom blend them with so that your client has the best outcome between treatments. So we do have a variety of Dermaprint forms. So this one is the original. This is from only YOURx. This is the original Dermaprint. This is what salon professionals are using in salons. We also created Dermaprint forms without custom blending. So there's nothing on the back, it's just blank if you do not want to do custom blending in your schools. We also have a Dermaprint form that's been simplified for aesthetic students and then super simplified for cosmetology students, because we know the cosmetology program is not that in-depth with skincare, so we've simplified it. So again, here's the original front of the Dermaprint form and the original back. This is the Dermaprint form without custom blending, and then this is the Dermaprint form for the aesthetic students. Now, if you are using only YOURx and you're purchasing the aesthetics kit, our kit was designed to follow 5 protocol treatments that can be performed out of your kit. So those 5 protocols, within those 5, you can perform 30 services. And then we just simplified the skin conditions. So we omitted irregular pigmentation, but otherwise it's pretty much identical to the original Dermaprint. For cos students, we super simplified it. You still need to figure out your client's skin type, and then we simplified the skin condition group. So we just simplified it to acne 1, acne 2, sensitive, and exfogel. And exfogel, AHA, is your maturing skin, so aging skin, non-compromised. And then, so once you've determined your skin condition group, on the back side, rather than having a full retail line, we've created facial protocols that correspond to the travel kits. So we have a home care products to be used for each of the skin types. So you would just grab those products and use those products to perform these services. Now your kit, the student cosmetology kit, only YOURx kit, has 3 protocols that they follow, and those 3 protocols correspond, and I think you can do 20 services of those 3 out of your student kit. So that is all the information I have for you on our Dermaprint 1 and 2, and I got you on just over an hour. So thank you guys so much for spending your afternoon with me. If you have not done so already, please make sure that you have typed in your full name, full school name, and location into the chat box for attendance. And I'm going to stay on for just a couple more minutes just to give you guys time to type that information into the chat box. And then I will be logging off. So again, into the chat box needs to be your full name, full school name, and location. Liz, which Dermaprint form would you like? The COS, the aesthetics, or the original? I can send you a PDF of the Dermaprint forms if you wanted to show your students. Let me know what school you're with. University of Cosmetology. Okay. Yeah, I'll have your agent, the AE responsible, like who's assigned to your school, I'll have them send over information on only yours along with the Dermaprint. My pleasure. All right, everyone, I am logging off. Enjoy the rest of your afternoon. Bye-bye.